Welcome to Not So Innocent Over-the-Counter Medications Part 2. Today we're talking about non-steroidal anti-inflammatory drugs, also known as NSAIDs. In that class, non-prescription, also known as over-the-counter, we have Advil, or its chemical name ibuprofen, Aspirin, or its chemical name acetylsalicylic acid, and Aleve, with its chemical name naproxen. There are many risks to these medications, but the majority of the population, I would say, is at a highest risk of these three that I will talk about, the first being cardiovascular risk. So, all NSAIDs can cause increased blood pressure, can cause sodium and water retention, which can worsen heart failure, and have been associated with an increase in the risk of cardiovascular mortality, that being just overall mortality, as well as being associated with myocardial infarction, aka heart attack, and also stroke. Gastrointestinal risk. All NSAIDs can cause acid reflux, also known as heartburn, and can cause gastrointestinal perforation, ulceration, and bleeding. Nephrotoxicity. All NSAIDs are considered nephrotoxic. They can cause acute kidney failure as well as contribute to worsening renal function with chronic use. So the key takeaway here is this is another class of over-the-counter medications that don't have a need for a prescription and therefore not as much follow-up from a healthcare provider, but they are not without risk.